The abbreviation STI is one of the most scariest letters you can hear from your doctor. STI means sexually transmitted infection or sexually transmitted diseases, aka STD. An STI is an infection passed from one person to another person through sexual contact. This goes for men and women. STIs are spread in different ways, including having unprotected vaginal, oral, or anal sex with someone who is infected. This also can occur during genital touching if someone is infected, during sexual contact between women who have sex only with other women, or from a pregnant or breastfeeding woman to her baby. In this video, I want to discuss sexually transmitted infections and infertility in women. Female infertility is a major public health concern worldwide. A lot of these cases of infertility are attributable to untreated sexually transmitted diseases that ascend along the reproductive tract and are capable of causing tubal inflammation, damages, and scarring. For example, according to the CDC, chlamydia and gonorrhea are important preventable causes of pelvic inflammatory disease and infertility. When this goes untreated, about 10 to 15% of women with chlamydia will develop this disease. Chlamydia is also known as a silent infection and is the most frequent reported bacterial STI in the United States. Most women infected with chlamydia or gonorrhea have no symptoms. Annual screenings for these infections are highly recommended by the CDC for all sexually active women younger than 25 years old, in addition to older women who tend to have new or multiple sex partners. Even though chlamydia and gonorrhea are treatable bacterial infections, they can still cause permanent damage to the female body. This is why practicing safe sex is extremely important. If your sex partner is male, you can still get chlamydia even if he does not ejaculate. And if you've had chlamydia and were treated in the past, you can still get infected again and again if you have unprotected sex with someone who has chlamydia. Pursuing this further, chlamydia can also cause a potentially fatal ectopic pregnancy, which is a pregnancy that occurs outside the womb. If you are pregnant and have chlamydia, you can pass the infection to your baby during delivery. This could cause eye infections or pneumonia in your newborn. Having chlamydia may also make it more likely to deliver your baby way too early. You should get tested for chlamydia at your first prenatal visit if you are pregnant. Testing and treatment are key to prevent health problems. How does one know if they have chlamydia? Like I said before, this is known as the silent infection. Most people infected have no symptoms, and if they do end up having symptoms, they may not appear until several weeks or even months after you have sex with an infected partner. Some symptoms in women include an abnormal vaginal discharge or a burning sensation when urinating. Symptoms in men include a discharge from their penis, burning sensation when urinating, or pain and swelling in one or both testicles. Men and women can also get infected with chlamydia in their rectum by having receptive anal sex. If one notices any of these symptoms, they should be examined by a doctor immediately to get testing and treatment. Testing is done through a healthcare provider and sent to a laboratory, while treatment is done through medication to cure the infection. A person who is infected should not have sex again until they and their sex partner have been completely treated. It is also highly recommended to be tested again 3 months after being treated to ensure the infection is completely gone. Discussing infertility, this means not being able to become pregnant. In addition, if a woman can get pregnant but keeps having miscarriages or stillbirths, this is also considered infertility as well. Unfortunately, infertility is fairly common. What causes female infertility? This can be many issues such as hormone imbalance, a tumor or cyst, eating disorders, drug or alcohol use, thyroid problems, ovulation disorders, damage to the fallopian tubes, excess weight, stress, and untreated STIs. Therefore, pelvic inflammatory disease and the silent infection in the upper genital tract may cause permanent damage to the fallopian tubes, uterus, and surrounding tissues, which can lead to infertility. When to seek help from a doctor sometimes depends on your age, or when you're trying to get pregnant before 35 and you're having no progress. Your doctor may also want to begin testing or treatment right away if you or your partner has known fertility problems. Even though infertility can be difficult to diagnose, there are a handful of treatments for women depending on the cause of infertility. Treatments can either attempt to restore fertility through medication or surgery, or help you get pregnant with sophisticated techniques. Being diagnosed with either an STI or infertility can be scary and emotionally exhausting. These are deeply personal issues that people deal with on a daily basis. In order to cope with such a difficult process, you can receive support mechanisms from your partner, family, friends, or professional support from a therapist. Overall, the most important thing to do is practice safe sex. Do it for the safety of your body and for the safety of your future.